Hello YouTube, this is Kesmaina. Welcome to my YouTube channel. This is a health and lifestyle channel where we talk about different health conditions and lifestyle modifications to accommodate the same. Karibuni. If you're new here, kindly remember to subscribe and also watch our previous videos. Remember to share. Thank you. So Leo, we are going to be talking about UTIs and STIs, and the reason we're talking about this is because there is some confusion kidogo. One may mistake a UTI for an STI and vice versa. So we'll start with UTIs, and the first thing we talk about is what it is. A UTI is an infection that is affecting your urinary tract. This means from where your urine is produced at the kidney all the way to where it's excreted. Jesus Christ. That is where your urethra is. Any infection in between there is considered a UTI. And the signs and symptoms of this include lower back pain, lower abdominal pain. There will be pain during urination and also some burning sensation. You may experience some burning sensation during urination. Also, you are going to experience, you may have a change in urine color and foul smell in urine, or a change in the smell of urine. Some people experience blood in their urine, which is also a symptom of a UTI. And also general body weakness, joint pains and fevers may occur. Not for all people, but it may occur. You may find yourself with fevers and general weakness if you have a UTI. So those are things to watch out for. And the next thing after the signs and symptoms, you're going to talk about the causes of or how a UTI comes about. A UTI comes about when a bacteria or a virus or a fungus, a pathogen rather, is introduced into the urethra, causing an infection of the urethra. This infection, this bacteria may ascend into the bladder and ikirudi back to the kidney. So yeah, that is how a UTI will come about. And of course, exposure, for example, if you wipe wrongly. Okay, let me just get into the predisposing factors. Kitu ina come about. So predisposing factors, first of all, before we go into that, I want to say that UTIs are very common in ladies, and the reason they're common in ladies is because we do have a short urethra. So if a bacteria ikisimama tu kidogo kwa urethra, likelihood yake ya kupanda into iende ikiendanga juu iko, before you now flush it out maybe by peeing or something, iko higher kuliko ya mwanaume who has a bit of a longer urethra. And before it gets all the way into the bladder ikiendanga huko juu, maybe atakuwa ameshafojoa ama bacteria ilishakufa ikaamua haitapanda. So that is the main reason UTIs are more common in ladies than they are in males. But pia wanaume wanapatanga UTI. Ni vile tu females tunapatanga sana kushinda wanaume. So yeah, so predisposing factors will include, now let me start for the ladies since nimeshawa mention. This will include improper wiping once you've done your business. Kama umetoka washroom, you should wipe from the front to back, not back kurudi mbele. This is because if you wipe from backwards kurudi mbele, you may introduce bacteria that resides kwa anus yako into your urethra. Na ukileta hapo, definitely, si tumesema infection inatokana na introduction ya bacteria into urethra, so you might get a UTI from there. And while we are still at that, I want to remind you to teach your child, your female child of course, about this as early as possible. Akae akikumbushwa that each time you pee, wipe from front to back. Usi wipe from behind kukuja mbele, front to behind. This will zuia you from getting UTIs. The other thing that predisposes ladies to UTIs again is wearing thongs. Thongs, unajua hapa katikati haikuangi na, what do we call it? Si panty, ni string sort of. So there is that string that is connecting your anus to your vagina, and when you're walking around, that string will be inafanya hivi. So possibility yake ya kutransfer bacteria kutoka kwa anus kukuja kwa urethra iko juu. So that is another factor. The other thing is use of public washrooms. Unapata if you use a public washroom, definitely you're not very sure of the hygiene ya hiyo public washroom. So I do not recommend you sit on the bowls. Hover around ikibidi, but don't sit on the toilet bowls, because again you're not sure of the hygiene, na kila mtu akitoka hawaoshi. So that means the person mwenye amekuwa mbele yako anaweza kuwa alikuwa na UTI. If you sit on it, it might urine might splash back to you, or bacteria might creep up from the basin back to you. That is another thing that may cause you to have a UTI. Now, again, while we are still at ladies, pregnancy it's not a predisposing factor, but it's what do I say? When a lady is pregnant, the immunity is a bit on the low. So not on the low, iko lower kidogo, and so getting a UTI or getting infections becomes very easy. Now, since you're a lady in the first place, tayari you're disadvantaged. Alafu sasa ukikuwa pregnant, again immunity yako imeenda chini. So again, in pregnancy, UTIs are a bit more common. So yeah, I think for the predisposing factors, we cap it at, oh, there is one final thing, sexual exposure. I think this is where I had forgotten it. UTIs can be brought about by sexual intercourse, but they are not UTI, they are not STIs, they are not sexually transmitted. What do I mean by that? I mean that when you're having sex, your urethra, first of all, for ladies, when you're having sex, there's a lot of fluids, there's a lot of wetness. So bacteria will be around you and around everywhere, including close to the urethra. So bacteria may creep from now the vagina and creep into your urethra. This may be the good bacteria that inakuanga resident ya vagina. Si tulisema there are resident bacteria in the vagina. Inaweza kuwa ni resident wa vagina lakini ame creep up, ameingia kwa urethra. Now that will cause you it may cause you a UTI. And to prevent this, I always advise that after sex, you pee as soon as possible. Yeah, as soon as possible, you heard me. Yeah, so yeah, I think. And prevention ya UTI ni kuavoid hizo vitu zote zenye nilisema nini ingine? Nilisema za ladies peke yake, poleni. For men, the most common is not drinking enough water and holding mkojo kwa muda mrefu. Ukikana mkojo for 8 hours, 10 hours, 12 hours, and you make it a habit, remember at the end of the day, mkojo ni uchafu inaenda kukua excreted. So, and we are holding it in the bladder. If you do this mara nyingi, again, your bladder might get an infection. So prevention ni sasa kuavoid hizi vitu zote, kukunywa maji nyingi, kukuwa careful wakati unatumia washrooms za public, kuavoid kuvaa thong, kujipanguza vizuri mbele kurudi nyuma. Nimesema kukunywa maji nyingi, nimesema nini nyingine? Yeah, hiyo, all those things. Na kutohold mkojo kwa muda mrefu. Sijui kama nimeshasema, but kama nimesema nimerudia. Yeah, so after prevention, huwa tunaenda into the management. Na management ni you go to the doctors, get a urinalysis ama a urine test done. The doctor atajua dawa atafaa kukupatia. Get a prescription from a doctor, not from Google. Usijitibu, pata prescription kutoka kwa daktari. So UTIs tumemalizia hapo. Next we are going into STIs. And STIs, these are infections that are now affecting our reproductive organs. Hiyo ni vagina, penis, cervix, what else? Urethra. Hizo tulisema urethra inaweza kuwa affected pia in an STI. So yeah, hizo STIs ni infections zenye zina involve your sexual organs. Not sexual, sorry, your reproductive organs. Sorry, I don't know what I'm doing. yeah, so STIs, signs zake ni, they may imitate symptoms of UTI, like for example, a burning sensation when passing urine, and maybe pain when you're passing urine. Other symptoms that now maybe are not similar to symptoms of UTI, this will include a vaginal discharge or a urethral discharge. Unaweza pata kuna discharge, whether you're male or female, you might get a discharge. And then also you may have sores or blisters or vinonda or even warts now on the vulva or vagina, and maybe on the penis as well, because we are talking about both sexes here. And then the other thing, painful sex. This is for the lady, and well, maybe for the man as well, I don't know, but because of the friction, I think kama uko na sores and then you're having sex, it may be painful, but I think it's for the ladies mainly. Then you may have bleeding after sex. This is now for the ladies. You may spot, it may be bleeding ama kidogo spotting. If you notice something like that again, it's something to be concerned about. And then also interperiod spotting in between your period, at a point where you're not expecting your period, alafu upate kuna spotting ama bleeding. That is again something that should raise alarm. Another symptom is pelvic pain. That for women, that is uchungu around your pelvis region. This may be like the lower abdominal pain and the lower back pain, and it may be chronic. Inaweza kuwa imekaa kwa muda kidogo. So yes, for men kunaweza kuwa na testicular pain or groin pain, ama kujikuna kwa the pubis, that too, because there are different types of STIs. Kuna hata zile kama something like, for example, scabies and pubic lice, they are considered they are considered STIs, but they are not invasive, haziingii huko ndani. They are just on the surface, on the external genitalia, so you'll be itching and quite uncomfortable. So hizo ni symptoms za STIs. Causes ni nyingi. Kuna bacterial ni yakina syphilis na gonorrhea, and then there's viral. HIV is one of the STIs. We know HPV is something, okay, mnajua HPV because of cervical cancer, and it can be transmitted because of it can be transmitted through sex. Alafu now others ni kama there's fungus, and now I've talked about scabies and pubic lice. Yes, so causes ni hizo. Now after the causes, we talk about the predisposing factors. Predisposing factors hizo ni, I think ni mbili tu: unsafe sex and having multiple sexual partners. So, and prevention ni nini? Practice safe sex and stick to one partner ban. Juu sasa, this is something I hadn't said before, but UTIs, symptoms zake zinakujanga mapema, they show up mapema. Like if I get a UTI today, at most a week, I will have experienced symptoms. But if I acquire a UTI today, naeza kaa hata mwaka kama sijawahi pata infection. So if that happens and I'm having multiple sexual partners, naeza kosa kujua ni nani alinipea ama nimepea watu wangapi kutoka hapo. So again, let's try to kwenda single na not multiple sexual partners. And if you have multiple sexual partners, then use protection. Yeah, but then again kuna vitu zingine zenye protection haitasaidia sana, like for example HPV even resides on the surface of the external genitalia, so hiyo inaweza kuwa transmitted either way. And vitu kama hizi scabies na pubic lice pia hiyo inaweza kuwa transmitted despite you having on a condom. But sijasema msivae condom, condoms zivaliwe, practice safe sex and concentrate on one sexual partner. Sijui kama ni concentrate ama try and maintain one sexual partner. Let's avoid having multiple sexual partners protect na to protect wengine. Yeah, so management for STIs, hizo ni uone daktari a diagnose, because there are so many ziko, they are quite a range. Discharge tofauti inamaanisha you have a different kind of infection. So there is no general treatment for STIs ama ati ufanye kitu specific, hapana. Different conditions zinakuwa treated differently. So if you suspect you have an STI, you see your doctor, ata-perform tests zenye atahitaji kuperform, and they'll get you a prescription. Alright, I think kutoka hapo si tumeshasema management. Sasa the main difference I think ni hiyo, what we've talked about, a UTI being noticed earlier than an STI. But yeah, I think that is it. And the similarities, I think, because especially for men will experience urethral pain. Each time a lady has a urethral pain, it may be because of just a UTI. But a man may experience urethral pain and it's STI, not UTI. So we need to get the difference there. But anyway, as I've said, differences ni hizo ziko hapo above. If you suspect you have a UTI or STI, kindly see your doctor, get a prescription. Tumesema msitafute prescriptions Google, na pia msiende ku Google the symptoms uko kwa internet. You'll get some panic because Google by the way can give you things. Google can give you diagnosis, hata inaweza kuonyesha unaenda kukufa kesho. So if you suspect you're sick, don't treat yourself. Tafuta daktari, investigatiwa, and yeah, utibiwe. So yeah, tumekuja to the end of our video today. I hope you've learned something. I hope that you will protect yourself, or you will prevent yourself from getting an UTI or an STI, and also to protect mtoto wako msichana, because we've said again wafundishwe. I'll not sitachoka kuambia hivyo. And also I hope you can identify when you're having these symptoms mapema so that you seek treatment. Thank you very much for watching. Tuonane hapa next time.